Hello everyone, my name is Ali Sheikh. I am the founder of the Trial A Optima Inc. Welcome to this clinical art programming course. In this series, I will show you how to work with the clinical trial data from start to finish using the R, including raw data, ADAM, TLF, and more. If you're new to clinical programming or want to learn how R is used in the pharma world, you are in the right place. Don't forget to subscribe so you don't miss any videos. Let's get started. Okay, so what are the clinical trials? The clinical trials are scientific studies where new drugs or treatments are tested on human volunteers. The goal is to assess how safe, effective, and tolerable these treatments are. These trials play a crucial role in bringing a new medicines to market. The clinical trial phases are happen in multiple phases. Phase 0 starts with animals and preclinical testing for toxicity. Phase 1 involves fewer than 50 healthy volunteers, focusing on safety and drug behavior. Phase 2 moves to 200 to 500 patients, testing both safety and efficacy, whereas the Phase 3 involves thousands of patients, checking long term safety and ideal dosages. Finally, Phase 4 happens basically it's the post marketing surveillance, the post approval, monitoring the large populations in real world setting. Okay. So the blinding in clinical trials is used to reduce bias. In a single blind trial, only the subjects don't know what they are getting. Okay, so in double blind, both doctors and subjects are unaware, and the triple blind goes a step further. Even the sponsors don't know. In open label studies, everyone knows the treatment have being given. Okay, when you come to the randomization and study design, randomizations ensure subjects are assigned randomly, reducing bias. Studies can be balanced or unbalanced based on the group size. Two common designs include crossover studies, where the same subject receive both treatments, and parallel studies where separate groups receive different treatments. So there are some period, washout period and epoch. The washout period is a crucial gap between treatments, allowing the body to clear any previous drugs. Clinical studies are divided into elements like screening, treatment, and follow-up. Groups of these elements from an epoch formed by specific rules. So the key study documents we required, there are several clinical document support in a clinical trial. The statistic analysis plan or SAP details analysis methods. The protocol defines the study rules, including inclusion or exclusion criteria. The case report forms or CRFs, collected data, and the CDISC standards like SDTM, ADAM ensures uniform data collection and analysis. Okay, when you come to the CDISC standards, the Clinical Data Interchange Standard Consortium, so this is organizations, it ensures consistency in clinical data. SDTM domains organize the data covering demographics, adverse events, lab results, and the vital signs. As of November, for the CDISC SDTM version, we have using November 22 as of today. I mean, the current version. So the BA/BE studies are ANDA. So this is the bioequivalence and bioequivalence. So in this program, our programming course, we will be explaining in this project the BA/BE studies. So the studies are vital for generics. So they ensure the generic drug works just like the original. Companies submit an ANDA, abbreviated new drug applications to get approval. For example, comparing drug X 10 mg to the reference product under fasting condition. Okay, here is the sample study title. So the sample study title you might encounter in this R programming course, a randomized double-blind balanced two treatment crossover study comparing drug X 10 milligrams to the reference under fasting condition. Every word here reflects the study design. Okay, I'll explain you in the SAP in a minute. Give me a second. Okay, so what are the clinical trial career scopes? The clinical trial industry offer a wide career scope. Major CROs like CVA and the Cytel work alongside by big pharma companies like Pfizer, Merck, and Roche. Skills in SaaS, Oracle, CDISC, SDTM are highly valued. You will also get trained in SOP, on SOP, SAP creation, and CRF annotations. Okay, so let's recap a few important terms. Inclusion exclusion criteria. Derivation SAP derivations defines calculation logics. The TLF table listing and figures present results. Lastly, interim analysis and ad hoc reports often helps decision making during studies. Okay, so let's continue with what are the SAP or the protocol has given. So this is the simple study title. Okay, so we have a double-blinded. So double-blinded, balance, randomized, two treatments, two periods, and two sequence. So in this project, we'll be having the two treatments and the two different periods, period 1 and period 2. Okay, so we'll be having the two sequence, either reference or test or reference. It is a single dose and crossover. In the period 1, the subject has test drug. In the period 2, he will be having the reference drug. Okay, so this is oral route of administrations and 10 mg comparing with the reference study drug. So it will be having around 48 healthy subjects. So they have as a human subject will be recruited in this study. So there is a washout period at least for 21 days between each drug of administrations. So the test drug is a 10 mg manufactured by Biopharma Private Limited in India. So manufactured for their Pharma Private Limited in India. So there are two manufacturers for this test drug, and reference is coming from the Oklahoma in USA. So there are some eligibility criteria. The volunteer will be participate in the study to have healthy adults. So basically he should have someone subject to participate in this clinical trial. He should must have 18 to 40 years of age, both inclusive and body mass index. Okay, so we are collecting the demographic data and medical history and general physical examination and some vital signs, ECG, hematology. So they all these data will be considered. Okay, so the duration will be 26 days, approximately 26 days. So we'll be having some study restrictions as well, so safety monitoring period. So this is the general information of the project. So let me show you how it looks like ADAM uh, implement study, ADAM and SDTM implementation guidelines. So in SDTM is the version we have right now is a 3.2 version right now in the system. So there is a new version is also available 3.4. You can have a look. So this is a simple, you should have to go understand the basic understanding of this document before you continue. I mean, so here we have a classifications of SDTM. Okay, so you will be having all this special purpose domains, interventions, and events. So you just go through all this data set, understanding what are the classification, what are the domains are present in this events classification, and what is the importance of these events. So if you go through this SDTM implementation guideline, you will be understanding basic understanding of in this like SDTM domains data sets. Okay, when you come to the ADAM, so this is ADAM. So I have right now is version 1.1, and here we have a classification of ADAMs. So ADAMs have a three major classification: ADSL, data structure. Okay, so ADLB, ADEF, ADTT. So this will all be working on together in this series. So we'll be doing the ADSL, we'll be doing the ADLB and ADVS, and we'll also doing the adverse event. We're covering all these three major classifications, and we'll be having doing some TLF as well. So the two listing and four tables. So I'll be providing all these documents once we finish this course. Yes, uh, that's it for today for this video. Thanks for watching. If you find this helpful, don't forget to like and share and subscribe for more videos. So if you have any got questions, drop them in the comments. I love to be here from you. Thank you so much for watching.